Deputy Troy. Deputy Chambers, you have the time remaining in this slot.
Thanks, Dáil. The most frustrating part of the news that came last week was that the budget for mental health had been raided, and it comes as no real surprise. Mental health services have been the poor cousin of the health sector for years now, and this move indicates that the outgoing government had no interest in changing that. And it is disappointing to hear the Health Minister, officials in this department and the HSE play down the fact that the 12 million earmarked for spending on the mental health service recruitment will now go elsewhere. And the Minister referred to pitching one area of the health service against the other. The very removal of the 12 million is the Health Minister pitching one part of the health service against the other. We all want to invest in our health service, but the absolute removal and the so-called justification of that from the other side of the House is shameful, and it's wrong, and it should change now. It is even more disappointing to hear the HSE's National Director of Mental Health, Anne O'Connor, last night on television say that the money had been returned, and she said, and I quote, she said she simply couldn't find any staff to recruit. She made the claim that healthcare professionals, and I quote, travel, and that is just the way it is. Now, for the Director of Mental Health in this country to throw comments about our health service and about mental health like that and say that she couldn't spend the money is also shameful. And it's wrong that the Director of a policy area in our health service would actually make those comments when we have an absolute crisis in mental health in this country. The answer showed no understanding of the real problem here. I raised the issue of staffing levels in the House last week during the statements on health. Young nurses and doctors are being driven out of our healthcare system because the paying conditions on offer are simply not good enough. And that's why hospitals in London, Sydney and elsewhere are benefiting from Ireland's young doctors and nurses. And I also got figures through a parliamentary question last week that showed that the Minister and the previous government's recruitment campaign for new nurses has been an absolute failure. Only 83 nurses have returned out of the 500 they sought to recruit. It hasn't worked, and we need to think of innovative ways to bring our lost generation of healthcare professionals home. The question must also be asked, if the 12 million could not be spent on recruitment, why was it not invested in mental health services? There are many other health services, for example, allied health professionals, psychologists, community-based therapists that could have made that intervention. And as we know, when someone presents to an A&E, they might see a psychiatrist, they might see the rapid care team, but it's 6 months before they actually get the intervention that gives them that treatment. And 6 months is too long. It's too long to leave a person with an acute difficulty in their lives, to leave them in that gulf, to take that risk. And it's wrong as a country that we're giving people that gulf in their lives of 6 months. I mean, we should have spent the 12 million on filling that gap. If you talk to any allied health professional, any psychiatrist, any community mental health team, it's the hemorrhaging of services around that team where they can't make that intervention at a community level. Stigma around this topic, even in 2016, is still a major issue. The only way to challenge this is to address the problem by tackling it head-on. As a society, we need to become more comfortable about talking about mental health. As legislators, we have a responsibility to promote debate and creating a culture where not being okay is okay. I was hugely impressed by the singer Brezzy and others in their efforts in championing the importance of good mental health. Equally, the recent viral video by Doug Ledden, who explained how young people feeling unwell have a tendency to put on a show and pretend all is okay. He said suicide is well documented but not well discussed, and this is a challenge we all face. He explained how more people lost their lives through suicide than road deaths last year.
Thank you, Deputy.
We are all very well of road safety campaigns, but how many of us would talk so openly about mental health?
Thank you, Deputy.
I'm just going to conclude now, Carla.
Deputy, we need to move on. There are other speakers waiting. Deputy, you had 10 minutes in total between you. There are two more speakers waiting.
You gave some discretion to others to conclude, and I expect the same, please.
Well, I didn't give them minutes, and you're well over time now.
The problems will continue and worsen unless mental health services are prioritised. This means having a clear and focused roadmap on exactly what we need to do, and above all, ensuring we have the necessary funding to achieve.